Hi everyone. Thank you very much for joining us today. We've got a really exciting announcement to be making today, and that is that I have got a team member that's going to be joining me in the Eden Clinic, which I'm really, really, really excited to talk about today. So, Felix Hay is an advanced clinical practitioner and is going to be joining us in Eden Clinic, which is absolutely fantastic news. It's going to be a real benefit to us. So, Felix, do you want to talk a little bit about you and your previous experience in the field?
Yeah, sure. Thanks for that intro, Angela. I hope I live up to expectations. So a little bit about me, I guess. Uh, I'm what's known as an advanced clinical practitioner, as you can see on the bottom of the screen there. We shorten that to ACP in the medical field. Essentially what that is someone who's gone on to do extended training, which I'll talk a little bit about more in a sec. Before that, I guess a few people may recognize me from previous roles or videos on YouTube about TRT from roles that I've undertaken in the past. But for those of you that are seeing me for the first time in Angela's channel on YouTube for the Eden Clinic for Men, my background's around 2 decades in the NHS, based primarily in emergency medicine, nursing, with some time spent in surgical nursing too. But that was way back when I was a newly qualified nurse in the first 3 years, and that was back in 2005. I've also got a little bit of a formal background and training, and I've worked quite extensively actually in medical research. So I worked for the National Institute for Health Research for a children's research network looking at investigational medicinal products. As a result, I got quite into the academic side of things. And I've gone on to take further studies. So I have a master's in medical science and advanced practice. And I'm lucky enough to have some published works in the literature as well. And I've also, you might find me on YouTube having presented at the largest pediatric emergency medicine conference in the world, which was a real highlight for me. But just briefly going back to sort of my beginnings, for a number of years, I worked as a nurse, a registered nurse. So I got my BSc Honours in that. Then I went back to the University of Sheffield and I undertook that master's degree in medical sciences and advanced clinical practice. Which included actually extensive study in pharmacology, and also I came out of that with non-medical prescriber status. So I can essentially prescribe anything I like that is specific to the disease state that I'm treating. This sort of background and qualification or further training allows me to see, diagnose, treat, discharge patients, or if necessary, I can refer on to other specialities. Then much like, I guess it's much like for people that are trying to sort of get a handle around what this role is, it's much like the traditional role of a medical doctor that people might associate with, just with a different title, I guess, and a different path to getting here. So I haven't done the traditional academic medical school route. And it's important to note that my registration is with the NMC rather than the GMC, so the Nursing and Midwifery Council rather than the General Medical Council. I have actually also done some further study after all of that with the Royal College of Emergency Medicine, or RChem, we call that. And I've done their what's called ACP curriculum. Now, this is a nationally recognised accreditation pathway, which consists of further academic study and then workplace-based assessments, where I'm supervised by consultant physicians and trained in more advanced skills. So I gained sort of extensive training or more advanced training is probably more accurate. The curriculum itself is actually very, very similar to what's known as the ST1 to ST3. That stands for Specialist Trainee Curriculum, that trainee doctors in emergency medicine undertake to go on their journey towards becoming a consultant. So I'm sort of, if you want to try and put it into the context of what people generally tend to understand, and that's medical doctors, I'm sort of mid-level trainee for that. So that sort of brought me to sort of this kind of status, and is what got me into looking at hormone replacement medicine. So I've obviously had a couple of roles in that before in other clinics, and that kind of brings me back round to today. Which I'm really excited about, to be joining the team at Eden, working with you, Angela, and the rest of your team, and hopefully helping some of you guys out there that suffer with testosterone deficiency.
Absolutely, Felix. I mean, that has got to be quite a unique career pathway. I don't think that there can be many people who've taken the same route that you have. And, you know, that is also going to add to a significant wealth of information, of studying styles, of critical thinking. So, yeah, welcome to the team.
Thank you very much. I've always had that sort of nature where I'm asking why things are being done rather than just being told this is how it is done. And that's what sort of got me into research and academia. And I've done some formal training about critical thinking and looking at critiquing academic research. So I'm quite well versed in sort of breaking down the scientific rigor and quality of research papers, which it makes me sound like such a nerd, but it's actually something I quite enjoy, is looking at the quality of evidence, because I don't ever really want to have someone say, I read it in a paper, therefore it's true. And I like to look at the minutiae of how valid that is and how applicable it is to a larger population, which I think is really key in TRT.
Yeah, absolutely. And particularly where TRT, there are some premises that are taken on, from the our international colleagues as well. And it can be quite trend based as well. And certain people come with different, very specific and firm opinions and objectives potentially. So actually ensuring that we're practicing evidence-based medicine, I think, is really, really important.
Yeah, for sure. Yeah. And you're right, you do. And I've seen it in my practice as well, and I'm sure you have. Is you get people that are perhaps have the best intentions, but not the background in order to be able to make a balanced decision. And you read something and take it as rote, that if it was ended up in a peer-reviewed journal, for example, it must be valid. Yeah. And that isn't actually always the case. You can get into a peer-reviewed journal and your results of that particular study might be absolutely terrible and not applicable to the person sitting in front of you. So it's about us being able to provide patients with that balanced and objective viewpoint, rather than it being a subjective thing about a goal that you want to get to, I think is where we can add value.
Yeah, absolutely. So tell me a little bit about your background specifically in men's health. What sort of drove your interest in this field?
Yeah, so it's like anyone, actually. I think this is quite common in TRT. It was certainly for male practitioners anyway. You tend to find there's a high amount of male providers of testosterone replacement therapy that have their own personal journey, and I'm no exception. So a few years ago, I've always been quite athletic. I was sporadically into weightlifting in my early 20s, but got quite into trying to have very fast run time. So I got quite big into running. So I've always been very lean. And then one year, when I was 35, I think, and I'm 41 now, I just suddenly ballooned up. And I had no change in my diet. I've never been a big alcohol drinker, and I felt horrendous. Like I had my head felt like it was going to explode. I looked at the time. I remember describing this to a GP because I was all over the place. I felt bouncy, and by that I mean I actually meant squishy. Like I felt squishy, and it was, looking back, I was retaining a lot of water. So I was actually quite edematous. So the benefits of having a clear mind and balanced hormone levels, I was not articulating well what my concerns were because I couldn't think. And unfortunately, I didn't have a great journey with the NHS. I think it's not at the fault of any individual practitioner. I think it was just a lack of knowledge and experience and time and understanding. So I went back and forth 9 months to different GPs, not just my one that I'd seen for a long time. It's like anybody, I sought another opinion when I just felt like something wasn't being addressed or my concerns weren't being heard. I got nowhere with asking anybody to do any blood tests for me, which was really rare because you generally tend to, if you say you feel tired all the time, you've gained a lot of weight with no dietary or exercise change, people who work in primary care, and I'm sure you're no exception with your background as a GP, you would probably do something called a TAT screen. And I didn't even get that. So I took it upon myself after 9 months and I was completely desperate. And I did my own bloods. Working in healthcare, I was like, let's go back to basics. Let's look at measurable things, because I don't know why I'm feeling the way I'm feeling, and I don't know why my body has changed and why my head feels like it's going to explode. So I didn't know what I was looking for. So I went online to a common provider of online blood tests. And I just got the one that was the most comprehensive, because I was like, I need to cast the net wide. I don't know what's going on. And at the time, I had relatively little knowledge about hormone regulation, other than what you're taught in sort of, for yourself, med school, and for me in my postgraduate study, where you look at the hypothalamic pituitary gonadal axis and how the body normally regulates it when it's working well. So I went into it sort of not completely blind, like a lot of people do. And I'm very well versed in interpreting bloods, working in a background of emergency medicine, so do that every day. So I was really, really shocked when my bloods came back, and I saw that my testosterone levels were less than 7 for my total, 7 nanomoles per liter. That is for our international viewers, and my free T was it was really low, and not at the time, obviously not being well versed and not having worked in that arena, I did what I always do when I don't know about something, and I take it upon myself to learn everything there is about that, because I'm of that personality type. So I did a lot of reading in a very short space of time, trying to absorb everything I could. And my reference point being that I did have a good understanding of how hormones should be regulated just from my training. So I went back to my GP and said, can we look at testosterone replacement therapy? He said no. So I ended up getting in touch with a private clinic that I actually ended up briefly working at. And that's where it all sort of began, really. And I started seeing patients in that field, and then I went on to be the lead at another clinic. And that's what's brought me here to you. So yeah, my journey was quite transformative, because as you can see, I'm not squashy now. So you know, and I've got it was my wake up call for turning my life around a bit. I was active and fit, but it really just sort of made me think, if I want to be this way forever, I need to cultivate an attitude and a routine towards health. And I've not stopped since. And I really want to not have any other guys out there have the experience I had. And that's the driving factor for me to do this. And is I want them to be heard, and I want to give them the time, and I want to investigate thoroughly and rule out everything else first. And then if it's in their best interest, help them the way that I was eventually helped.
Yeah, and I think that's fantastic. I think it's so important as a clinician that you recognize the unheard voice, and that you can empathize with that, and you can maybe even identify with some of the frustrations that people come preloaded to you with, and that can actually sometimes be quite off-putting as a clinician, that somebody walks into the room shouting at you because they've had to shout at the person before and not quite had the right response. So I think actually, that experience for you as a provider is going to be really, really helpful to help you sort of guide those guys that have had that tough time on the way here. I think also you touched on something else there, which was quite interesting, about saying that, once you realize you've got this diagnosis and you'd started on that treatment path, about, realizing that actually you wanted to create some useful life habits around supporting your health moving forward. That's certainly something that I sort of encourage people to develop, almost, for want of a better phrase, almost a mindfulness and a consciousness of life, and actually actively making decisions rather than letting things happen, because you can become quite passive once you've had a testosterone deficiency, and actually actively making those choices. So tell me a bit about that for you. How did that look for you?
Definitely. I mean, I completely agree. And mindfulness is the right word, because as human beings, we're not very good at in-process evaluation. We're very good at reflection, and a lot of us do it without even realizing it. Something will happen and we will just think about it. That's naturally what we do, because we're high-level beings. Our cognizance is one of reflection and evaluation, so that we don't, in evolutionary terms, so we don't die as a species. And that's how we've come to be where we are. But what we're not great at, and I think takes a lot of practice, is in process, if you like, reflection, and that's evaluation. So in the moment where emotions, because that's another thing we have that, other animals can have, but not to the level that we have, is where you feel an emotion, but it temporarily causes this what's called a cognitive dissonance. So it detaches you from rational thought. And mindfulness is an exceptionally good practice to allow you to be able to not, what I'm not saying is push these emotions down. It's allowing you to, in the moment, put a little dampening on them and not allow them to dictate what you do next. And that's where this active thought process comes in that you're describing. Complacency is very understandable when you have a hormone deficiency or any kind of hormone dysregulation. And it's very easy for us to go, oh, if I just didn't have X, things would be fine. When actually, most of the time, even with X, we still have a lot of power. And I think mindfulness is something that brings that to the fore, because you can say to yourself, those sayings that your parents or your grandparents might have said to you when you're little, you can talk yourself out of things. You can actually talk yourself into things as well. So, and that's where what I think mindfulness really does help with. Because and journaling, like I think you're a big fan of that as well, where you actually write down your thoughts so that if you're not good at reflecting on them in your head, you can read them back to yourself and go and look back a couple of days later and say, oh my goodness, I said this in that moment and I really didn't mean it. And then look at what the meaning of that was and what the circumstances were, so that when it happens again, you have that mindfulness to go, I've been here before, I recognize this and I can control this. It's a really powerful thing to do, and it can be so transformative.
Yeah, absolutely. Absolutely. And I think for a lot of guys who are sort of starting that process while they're beginning that process of, sort of resetting things, really, it's a really good reset. And it's also great when you're struggling to measure progress on that journey as well, when you're thinking, well, hang on, are things much better? Or particularly because sometimes people will have a sort of a significant improvement and then they'll think, has it got that much better actually? And they can't, it can be quite useful to go back through that journal and be sort of bringing back to memory times where actually things were significantly harder or maybe even better, and actually things have changed. But I think it can also be quite helpful to when you're having that conversation with somebody who may have actually already started their treatment and they're saying, well, my dose can't be right because this, that, and the other is going wrong, or I'm not feeling right. And it's like, well, tell me about everything else. How's life? How's work? How's relationships and things like that? It's like, oh yeah, work's awful. I'm barely getting any sleep. And right, okay. So I don't think testosterone is going to make that much of a difference there, but actually develop that awareness and actually practicing sort of increasing that situational awareness, I think, can be really great as well.
It's something that I think should be practiced by more people, but is not easy to get started with, especially if you don't know where to go or what you're doing, or if your hormones are all over the place.
Yeah, absolutely. And I think a lot of the time if you ask people to sort of implement journaling and things like that pre-TRT, if they're truly testosterone deficient, they might not even have the concentrations. A lot of the time they wouldn't have the motivation to, and all of those bits and pieces wouldn't even be in place there really to be able to sort of facilitate that process anyway. But it can be a really good line in the sand to sort of invest in that stationery before sort of moving on from that point forward. So fantastic. Right. Well, I think, it's been absolutely fantastic introducing you to the clinic today. I'm really, really excited about having you come join the team. I think it's going to be fantastic. You're going to be a really, really good addition. And I think it will be really useful to see whether or not there were some questions that people would like answered potentially from the back of this, and maybe some videos that we could do together after this. So if anybody does have any particular burning questions or anything that they'd like us to address or to start talking about together, perhaps they could drop them in the comments down below. That'd be fantastic.
Yeah, brilliant. No, and I'm super excited as well, Enza, to be getting started with you. And like I said in the beginning, hopefully helping some guys out there that are struggling. And any ideas or suggestions for videos or questions you have either for me or for the team, then drop them in the comments below, and we'll see what we can do.
Yeah, excellent. Can't wait. Watch this space.